away. So it then just inspired me to get more involved with it, because I'm like, this was my story. I was told, this was just anxiety or it was in my head. And the symptoms were just unexplainable. And I started just working with patients with it. And there's definitely an overlap between that, autoimmunity. That's why they call it the great imitator, and is also mental health. I think that's how I started getting into more of the mental health aspect too, because a lot of our patients too, which I know we're going to talk about today, have mental health issues related to the tick-borne infections as well. The most common initial symptoms are sometimes you can have a high fever, fatigue, really significant fatigue. Joint pain is the other common symptom. And some people will get neurological symptoms. So I've had patients that got, after a tick bite, they got Bell's palsy, which is like the paralysis of the face. So what they'll often do if that happens, they go to the hospital, they might test like the cerebral spinal fluid for Lyme disease itself. But typically the most common symptoms are joint pain. One of the common symptoms for Lyme is you'll have like migratory joint pain, which is actually helpful because when you look at like rheumatoid arthritis, it tends to stay in specific places. Whereas with Lyme, you'll see it rotate because of the spirochetes. Fatigue, headaches are another common symptoms, as well like fever, like I said, is a tip-off. So those are kind of the most common ones. And then testing, they're usually going to do, ideally, hopefully they're going to be testing at least for the Western blot. But initially, they typically will do an ELISA test when they're testing.
Yeah. And some of those tests then like 56% can be negative, right?
Exactly. But it's more likely to be false negative than positive. Yeah. So that's why you definitely, is a suspicion and you're negative. Technically, per CDC, Lyme disease is a clinical diagnosis. So it shouldn't be made purely decision on the laboratory work. It should also be matched with clinical symptoms. So, and one of the issues is the fact that many people will be false negative, and women even more so. And then when you look at infections, most people have autoimmune conditions have one or two chronic persistent infections. So all of my patients with, let's say, rheumatoid arthritis or lupus or any autoimmune condition, I'm always testing for other viruses and bacteria to see, because sometimes when I actually work on, let's say, Lyme disease that they had and they had rheumatoid arthritis, I'll see their rheumatoid arthritis symptoms get better, or I'll see the rheumatoid factor, their serological, their blood tests improve when I handle Lyme disease.
Cures, Remedies, and Beyond podcast with Dr. Irina, a Stanford-trained medical doctor, inventor, and a published author with over 30 years of clinical experience, is bringing together the science of medicine and the art of healing for ultimate vitality and health. It engages in discussions with healthcare providers, wellness experts, innovators, philosophers, spiritual and industry leaders, as well as health and wisdom seekers to provide you, the listeners, with practical tips and knowledge to help optimize your health and well-being. The Cures, Remedies, and Beyond podcast with Dr. Irina.
Today we're going to dive into a powerful and often misunderstood topic, Lyme's disease. Over the years, there has been a significant increase, with reported more than 500,000 new cases of Lyme's disease annually, which is substantially higher than the annual cases for diseases like HIV or AIDS. And unfortunately, this tick-borne illness receives less than 0.2% of the public funding allocated for HIV, for example. It is very common for the patients with Lyme's disease to be misdiagnosed, undiagnosed, or simply dismissed by healthcare providers, forcing these patients to commonly see multiple providers, from 5 to 7 on average, until they get a proper diagnosis and treatment, and sometimes at much later stages of their disease. I'm very excited to be joined by a nationally recognized naturopathic physician, 3 times Amazon best-selling author, including her book Women and Lyme, and the medical director of Fairfield Family Health Clinic, Dr. Jaquel Patterson. Thank you for coming.
Thank you. Thank you for having me, especially Dr. in terms of just a really important conversation. So that there continues to have a need for greater awareness and visibility as it pertains to this topic, because as you mentioned, on average, people see it at least 7 to 9 doctors. I feel like it's even higher than that. And so because of many people just don't even know to even ask to get that even looked at or for a provider to actually work it up. Really
Exactly.
excited to talk today and what are some of the implications, what to look for, and yeah, looking forward to the conversation.
Yeah, and you obviously are one of the most qualified physicians to discuss this topic because you not only have more than 15 years of clinical experience with the focus on Lyme's disease, autoimmune conditions, you also integrative psychiatrist and environmental medicine specialist, but you're also a past president for the American Association of Naturopathic Physicians, which is a great achievement.
Yes, I'm really
You're,
super active in leadership in the profession. Yes.
yeah, and you're on the board, I understand now, of environmental medicine. Yeah, so also you're a speaker and a published author for USA Today, New York Magazine, Forbes, NBC, Fox, and several others. But also, I understand that you have a personal experience with Lyme's disease, which is
Yes.
obviously incredible value for our listeners to discuss this topic with you. So, would you mind sharing your story?
Yeah. So I'm not the only, I myself and some of my family members, particularly my father as well, also had Lyme disease. And at the time, I actually had it likely, I don't know the exact time, but likely when I was around 29. And I was kind of finishing my last year of naturopathic school. And during that time, I had a lot of the symptoms my patients often say of kind of all these symptoms that are kind of nebulous, like fatigue, joint pain. I would have like really bad knee pain. The next day it would go away, and then all of a sudden I had shoulder pain. So it starts feeling like, and it's commonly the piece of like it's in your head. Why am I? How would my neck? My neck hurt today, really bad, significantly pain, and then the next day it's gone and it moves to a different part of the body. So I had that. I had anxiety in my last like 2 years of actually naturopathic school. I didn't even realize I was wearing black for like a year and a half because I would be completely drenched. And that was likely because I also found out I had Babesia as well as Bartonella. And so I was one side drenched. And at the time, especially in my 20s, I was told it was anxiety. But I said, if that's anxiety, why am I getting it when I'm going to the grocery store shopping? Or at times when I was like really relaxed, um, I would get hot flashes, headaches, things like that. So symptoms didn't match up. So I actually went to several doctors, just like our patients. I went to a rheumatologist and they were actually thinking it might have been some kind of autoimmune condition because my ANA was also positive. And I have a family history. My mom has lupus, my aunt has lupus. So it was looking like it could have been the beginning phases of that. But everything else was coming back negative. And so what happened was, I did a lot of self work. I did some herbs and some other, I wasn't clear, clear exactly what it was, but I do remember coming back with like a pretty significant bite at some point during the time I was at school that they thought was obviously like a spider bite. And I assumed that was probably the time that I got it. So it wasn't until like years later when I started working with patients that I said, wait a second, these symptoms sound, just like the symptoms I had back then. And so I tested and everything was positive, actually active infection positive for Lyme disease, Bartonella, and Babesia. So obviously went through the treatment for it, but I could have, it was years, it had already been many years. So just like patients, they start these symptoms and you start going out to all these different people to try to find out with no answers. And I don't believe they ever even tested me for Lyme disease at that time because they were looking at autoimmune conditions. So that happened to me, doing well, healthy. And my dad also, same thing, got bitten, went to the hospital, had fever, all the classic symptoms. And they said it was just a spider bite, sent him home. Then after he was in his 70s, he said he's the kind of person that cuts his lawn himself, 6 acres, cuts trees, like all kinds of stuff in his 70s. And he started getting really tired. And he goes, well, Jaquel, maybe I'm older. Maybe I need to slow down. And he said, it seems like ever since this thing happened, I've been sick. So I said, Dad, just make sure they test for Lyme disease. Sure enough, it was IgM positive. For him, it was fast. He took antibiotics, one course, and he was fine. Everything went back. So, all his symptoms went away. So it then just inspired me to get more involved with it because I'm like, this was my story. I was told, this was just anxiety or it was in my head. And the symptoms were just unexplainable. And I started just working with patients with it. And there's definitely an overlap between that, autoimmunity. That's why they call it the great imitator, and is
Right,
also
right,
mental health. I think that's how I started getting into more of the mental health aspect too, because a lot of our patients too, which I know we're going to talk about today,
right.
have mental health issues related to the tick-borne infections as well.
Yeah, which is an incredible insight. Of course,
Mhm.
some people, they don't even know that could be a neuroinflammation, as we know. But Lyme's disease is more prevalent, of course, as we know, in certain regions of the United States, particularly in the North, East, Upper Midwest, and Pacific Coast. But the geographic distribution has expanded over the years, with even more countries reporting higher incidence rates. Why do you think the prevalence is increasing? I mean, do you have any thoughts on that?
Some are talking about climate change in terms of warming climate. They actually just released a study I saw in I saw on PubMed that just got released, and it was a study for Babesia, and the increase since 2015, about 9% increase every year. And some of the reasons they said was the temperature has also been warmer, so it allows for more reproduction, in terms of having more, because typically Lyme disease or any tick-borne diseases are more common in the spring and in the summer. But they are found year round, but it's just that reproduction is typically in those warmer temperatures. So warmer climate is potentially one of them. And then the other thing is there are also a lot more subspecies that, depending on the testing, if you do conventional tests, they may only test for like Borrelia burgdorferi, not for all the other subspecies. And there are many other subspecies that are in other countries. Even like I have patients from that have went to Europe or have went to Mexico or went on vacation to the Caribbeans, and they said they got bit, and then we test them, they had Lyme disease. So sometimes there's also different subspecies of Borrelia that are throughout the country. And a lot of people think, oh, it's just on the Northeast, it's just in Connecticut where it was found. But there's actually almost every state has had diagnosis of the Lyme disease. So there's big patches on the East Coast, definitely a lot on the West Coast, less so in the center, but there's also different type of ticks like Rocky Mountain spotted fever and things like that as well.
Right, right. And of course, you mentioned one of the most pathognomonic rash, the bullseye rash,
Mhm.
right? So how else people can actually have some insight that, maybe, you know, there is a Lyme, so that they were actually bitten by a tick, and they might actually have Lyme's disease in the earlier stages. Like, I mean,
So
it took you years to be diagnosed, unfortunately, right? So, but if it happened, if it happened relatively recently, so what are the tests? What are the other, markers?
markers, yeah. So typically, there's like stage 1, stage 2, stage 3. The most common initial symptoms are sometimes you can have a high fever, fatigue, really significant fatigue. Joint pain is the other common symptom. And some people will get neurological symptoms. So I've had patients that got, after a tick bite, they got Bell's palsy, which is like the paralysis of the face. So what they'll often do if that happens, they go to the hospital, they might test like the cerebral spinal fluid for Lyme disease itself. But typically, the most common symptoms are joint pain. One of the common symptoms for Lyme is you'll have like migratory joint pain, which is actually helpful because when you look at like rheumatoid arthritis, it tends to stay in specific places. Whereas with Lyme, you'll see it rotate because of the spirochetes. Fatigue, headaches are another common symptoms, as well as like fever, like I said, is a tip off. So those are kind of the most common ones. And then testing, they're usually going to do, ideally, hopefully, they're going to be testing at least for the Western blot. But initially, they typically will do an ELISA test when they're testing.
Yeah. And some of those tests, then like 56% can be negative, right? So,
Exactly.
but
It's more likely to be false negative than
false negative.
positive. Yeah. So that's why you definitely, is a suspicion and you're negative. Technically, per CDC, Lyme disease is a clinical diagnosis. So it shouldn't be made purely decision on the laboratory work. It should also be matched with clinical symptoms. So, and one of the issues is the fact that many people will be false negative and women even more so likely. So there's been studies that show men, for example, with Lyme disease, for IgG, you have 5 bands to be positive. So they've had studies that show men are more likely to have, like, let's say 6 bands, and women are more likely to have like 4 bands. So that means they won't even produce enough antibodies to be shown as positive. So that is oftentimes why women tend to, if you look at the studies, tend to suffer from it for longer periods of time, because they likely weren't diagnosed and treated earlier on in the time frame.
Yeah, that's very interesting. As I mentioned, you wrote a book specifically Women and Lyme. Are there any other factors that contribute to women experiencing it differently from men by any chance?
Yes. Yeah. And the reason I wrote that book was because there's not really, I started seeing a pattern for my patients, and there wasn't really much content out there as it pertained to that. Hormones, mental health, which is typically more common with, women than men. And so what would happen was, when you look at symptoms for Lyme disease, they're worse for women that are perimenopausal. And then also women are more estrogen dominant or have really bad, let's say, menstrual cycles. So I wanted to kind of make sure there was a focus on that. So when you look at perimenopause, all those hormones drop down, like estrogen, progesterone, testosterone, and progesterone and testosterone are actually like anti-inflammatory. So all those things that help to protect inflammation, including even estrogen, because estrogen protects the joints, that goes down. And then so that's why the symptoms can seem even more amplified. Or I have women, like right before their period, something called prostaglandins gets released, which helps with the lining of the uterus. And that also increases up all the inflammatory markers. So now they're inflamed, and all their Lyme symptoms, the same as my patients with autoimmune conditions, are way worse. So what I would see was, like, I'm working with a patient, and then I would have like a menstruating woman that has issues with their cycle, would keep coming and going. Like, they do well and then they do bad. They do well. And so we had to always address the hormones. Also, there's studies. So you look at adrenal glands, you look at the endocrine system. There's a lot of studies too, that if there's an issue with cortisol, which is related to your stress hormone, and that's dysregulated, it means you might be more sensitive, or like not as responsive, or overly reactive to antimicrobials or antibiotics. And so lots of times we have to also support the adrenal glands too when we're working with patients.
That's interesting. I listened to a wonderful presentation at the conference, and you did mention that, of course, importance of cortisol and its impact, how supportive it can be, and also for mood, for energy, for memory, right? So that's a very interesting point. But since we're talking about that, can you tell us a little bit more? How can tick-borne disease cause neuroinflammation?
Yes. So what happens is, so there's many ways of neuroinflammation. So infections are is a possible trigger for neuroinflammation. So infections like Lyme disease, also other bacteria and virus, like even like EBV, other things like that, can also cause what's called neuroinflammation. And then there's also like TBIs, traumatic brain injuries. I'll see my patients that have had like lots of concussions with Lyme, that might even be worse. Obviously, chronic disease conditions like diabetes and things like that are also going to be problematic. But basically what happens is you have your blood-brain barrier that protects things from coming, in and out. And so for the most part, your brain does a good job of obviously keeping all of those out. However, about 1% to 2% solutes can actually go through. And so what happens is there's this chronic kind of inflammation directly on the blood-brain barrier, or this constant disruption that will cause that can cause neuroinflammation. And when neuroinflammation occurs, you activate what's called the microglia. And so microglia are what they call like the macrophages of the brain. They come in, they clean up things in the brain, get rid of stuff, which we need. Inflammation is also not a bad thing, I always say. It's not bad to have inflammation. It's because your body can then repair itself and move. However, if it's chronic, that's the biggest part. So the chronicity is the biggest concern, because it causes this constant activation of microglia, which causes that neuroinflammation and leakage and things like that into the brain.
Yeah, that's when people are really experiencing the forgetfulness, brain
Mhm.
fog, anxiety, headaches,
Exactly.
right? So what are the other symptoms of this neuroinflammation that
So
people
definitely
experience?
you'll see what you said, like brain fog. I'll have patients that say like disassociative, like they don't feel like they're there or present. You can have definitely symptoms that can lead up or just like inflammatory markers that'll go up, which increase things like anxiety, depression. There's a saying for like Lyme disease and Bartonella called like Bartonella rage or Lyme rage. We'll see like a lot of mood instability. We have kids that have something called PANS and PANDAS, which is a pediatric acute neuropsychiatric syndrome, where there's this inflammation to the brain where like overnight acute inflammation, a kid will change, or they have OCD, restrictive eating, tics, like motor tics, insomnia, sleep issues. And that all comes from like this inflammation to the brain, but there's kind of like this autoimmune response where their body is kind of like overreacting, over responding, which causes a lot of mood changes as well. So it could be varied symptoms, including mood dysregulation as well.
That's interesting. And that, do we know yet the causes of PANDA, or it's still
So
quite?
so it's from infection. So when they say PANDAS, it's related to infection related to strep. But there are other common reasons for getting PANS and PANDAS. Could be from any bacteria or virus, including like mycoplasma, which is walking pneumonia. In terms of tick-borne diseases, one that's most often connected is Bartonella. But it could even be things like mold, like high mold counts or mold exposure can also, or chemical exposure can also cause it. It's really this like that body's response of this autoimmune response to an environmental, it could be environmental exposure or just any exposure that's causing that reaction, that's causing the inflammation and the body to respond to that, specifically in the brain.
As you said, it's like our body is trying to help and eradicate, eliminate the pathogen, right? So the causative factors. So, but along the way, damaging, so a lot of territory, right? So
Yeah, if it's chronic. So if it keeps happening, it's like it's trying to keep up as much as it can. But if it's a chronic piece, that's when you're causing that permeability issue where you're going to have more of a problem.
right. And you also mentioned that women, in particular, since we have a double X chromosome, right? So that codes
Yeah.
for a greater amount of, I guess, immune-related genes, So also,
Yes.
there's a difference, as you said, right?
We're
So
more complex.
yeah, enlighten us on more on that, So why women do have more autoimmune disorders, right? So
Yeah.
autoimmune responses to this, infectious origin, and other environmental factors, all those pathogens, so to speak. So yeah,
And so so there's several different theories. So some is obviously hormonal, because estrogen, as I mentioned, progesterone, and working more on the Th2, T helper cell 2 response, and testosterone being more anti-inflammatory. Women obviously have less testosterone than men. So that's one piece. And estrogen is actually good for helping with inflammation. However, too much is actually more pro-inflammatory. So it's like it's having a hyper response to the body. That's why you'll see women, I don't know if you've seen that clinically, like where when they're ovulating, they'll get hives, there's like allergy response or more symptoms, etc. So estrogen is great, but in a high amount, it could actually be more pro-inflammatory. So that could put you at risk for autoimmune conditions. The other thing is you look at the chromosome, like you mentioned, XY for males, XX for women. XS has more, like in terms of genetic, in terms of more likely to have kind of a disruption with that, which could predispose you, if there's more DNA, genetic information, you're going to be more likely to have a possibility for an issue, for autoimmune conditions. Also, those are two huge factors outside of lifestyle and stress and those things, which women also report as more chronic issues than males do, which are also going to trigger potentially up an autoimmune condition as well. But hormones are a big factor, and one of the things I always will note with patients is like after pregnancy, after having a child, perimenopause, like menopause, that's also a risk time for autoimmune conditions. And then when you look at infections, most people that have autoimmune conditions have one or two chronic persistent infections. So all of my patients with, let's say, rheumatoid arthritis or lupus or any autoimmune condition, I'm always testing for other viruses and bacteria to see, because sometimes when I actually work on, let's say, Lyme disease that they had and they had rheumatoid arthritis, I'll see their rheumatoid arthritis symptoms get better, or I'll see the rheumatoid factor, their serological, their blood tests improve when I handle Lyme disease. I'll see somebody with Hashimoto's whose antibodies will be like 300 or 500 that might not have gotten retested, again, because in naturopathic doctors, functional medicine doctors, we're looking at that. And you'll see you treat someone with Lyme, the number will go down to being below 100 and maintained. I've had patients where I've done that. I have a patient recently and she's like, my ANA is no longer positive. It was positive for 12 years and she had lupus after we handled the tick-borne infection. So you have to think those things can just trigger up inflammation where your body's seeing it in an autoimmune condition and having a hyper response and reacting when it doesn't necessarily have to.
So interesting. And I remember you mentioned also at the conference that low estrogen levels, and like in reverse, it can help you to get diagnostic clues that low estrogen levels in a young woman should be a red flag to look at the underlying infection.
And also men, low testosterone, because you probably have been seeing that too. Like I've been having a lot of men in like their 20s and early 30s whose testosterone technically is okay, but their number is on the bottom end of the range because conventional labs, the gap is, let's say, 600 to 800 points. So they'll say it's okay. Let's say the range is 250 to 800, but their number is 300. And I'm like, you're 28. You shouldn't be at 300. That's for somebody that's like in their 60s. So that's also a red flag to me because the testosterone for a man is also protective. They're going to have brain fog. When your testosterone's low, you're going to have brain fog too. You're going to have issues with physical, like stamina. You're going to have issues with weight management and muscle tone and things like that. So that also is a red flag, especially someone that's younger, because something is going on that's disturbing.
That's really interesting. And I love your integrative approach. So obviously whole body approach, so that you use, with your patients' diagnosis and treatment. So what are your typical panels that you test, let's say, with the new patients?
Yeah, so I usually, so depending on what they're coming in with, if they're coming in with those symptoms I mentioned, like, migrating joint pain or brain fog, fatigue, headaches, things like that, I'm definitely going to do a full autoimmune panel. Plus, I'm also going to check for things like cortisol, AM cortisol or PM cortisol. I'm also going to definitely check for tick-borne infection. So typically what I like are, if ELISA, I don't like the ELISA. I'd rather at minimum do the Western blot, but the immunoblot is even better because it has higher level of specificity. So I'll do immunoblot IgM, IgG. For that, I'll test for Bartonella, Babesia, Ehrlichia, Anaplasma, sometimes Rocky Mountain spotted fever, depending on their location. I also will test for inflammatory markers like CRP, ESR. I might do also things like IL-6. One of the also markers for how well you're managing things with like Lyme would be like CD57. This is if somebody already has it. And then I might look at some of those hormones that I know are protective too for them. So it also depends on like if somebody's like 55 or 60, haven't had their hormones checked before, I'm going to say, okay, let's look at that and see how much, because I've had patients where their testosterone's at like 0, like a woman, like just the one I saw today was at 1. So I'm like, okay, we need to get that up because that alone might make you feel better. So we had that. And I've also had, this is another thing I always like to mention, is patients with iron deficiency and ferritin. So that comes up a lot. And a lot of patients will say, oh, my doctor already checked. I did what's called the CBC, which is a complete blood count, which checks for like red blood cell and white blood cell. And I always say that gives some information. However, ferritin is actually a marker for acute inflammation. So that also, so you'll see like someone even gets a virus, it'll go up because it's trying to get like oxygen out to the tissues to heal. And then it'll drop down. So you'll often see also low iron, which will also contribute to fatigue. So it could be because of the tick-borne infection, but at the same time, you still have to handle the low iron levels too.
That's actually, that's a great way of looking at it. So I didn't know that you use ferritin. And you do, sounds like you also put people on the hormone replacement, like by identical type of
Sometimes,
hormones,
depending on
if
how the
needed.
numbers are. We do oftentimes herbs and things like that too. But sometimes if someone is older, it's just harder to get up there unless, we can get it to increase, but maybe not significant enough unless there's like bioidentical hormones or hormone replacement therapy that we will work with, the prescriber to have.
And what are some lifestyle factors we can change to help with neuroinflammation? Are there any other specific natural approach?
So some studies that have shown to help with like inflammatory markers, particular CRP, is sauna. So far infrared sauna, actually they've had the same for sauna as just the sweating, but they had had some studies in, I'm like, is it Finland or Sweden? But it was basically like thousands of men that were studied over a period of a couple decades. And what they found was there was lower incidence. Actually, this was more mental health, like schizophrenia, mental health issues, if they used saunas more regularly. And so there were studies, and this was over like followed for 20 or 30 years, for decades. And so that was really interesting because it actually showed literally lower CRP levels, which are markers for inflammation. So, and also they also had better mental health function. So that's one. I always like to look at things like grounding, or I always tell people, like, what are the things that bring you joy? Because that could be different for everybody. So like, how are we doing those things? Because they've shown even like meditation, especially mindfulness meditation, decreases inflammation, which also is something that will benefit you mentally in terms of the neurotransmitters, but also helps with inflammation. So I always like to see, like, what are the things you like, could be walking, hiking, like they've shown forest bathing actually helps with the natural killer cells, forest bathing, and inflammation as well. So, being out, I know we're talking about Lyme disease, so that actually gets a lot of people scared too. Well, I don't want to hike anymore now because they're scared of ticks.
That's where I got it from.
That's where I got it from. Now Dr. Patterson is asking me to do forest bathing, but it has shown like being in nature, because think about in our society now with like technology, we're so disconnected. So I always tell people lifestyle could even be just, turning off the computer, turning off the TV at least an hour before you go to bed, or some level of quiet, or just away from distraction. Is probably why I love spas and things like that, because you have to I personally lock up my cell phone. And then, it's like, oh, I feel at peace. Why? Because I wasn't using my cell phone for 3 hours. There wasn't any connection in. So things like that are just like small baby steps. I always tell people not to try to feel like you have to make these major changes, do like these small increments that you'll actually see an improvement.
And get outside on the sunlight, right? So because vitamin D3 is pretty crucial for immune system support. Yeah. Are there any also additional specific diets that you put people on while they're battling with Lyme?
Yeah. So for Lyme disease, so I know alkaline diet. I know Dr. Darren Ingalls recommends that, and that one is more typically staying away from obviously like standard American diet and removing gluten, dairy, more processed foods. But what happened, the logic behind that was that Lyme disease does really well in more like lactic, like acidic environments. That's why people will be worse in like the summertime or heat and things like that. That's why even with sauna, I mentioned I'll recommend sauna, but not too long initially when somebody has Lyme disease. So basically foods that are in alkaline diet, they're more like anti-inflammatory, but they're also things that are more neutral and not like acidic. So that's one. When we're looking at like mental health, the studies that have been done are actually Mediterranean diet, also a diet called the Mind diet. It's very similar to Mediterranean diet, a little less on like fish and things like that. And then also ketogenic diet. So ketogenic diet has also been studied, especially for women like perimenopause, menopausal, as well, to help with like brain health and also mental health as well.
Had some studies that it's actually really productive for even schizophrenia and other pretty serious mental disorders. Yeah, that's interesting. So I want to talk to you about biofilm and biofilm disruptors that I understand are pretty crucial for chronic Lyme.
to what they are, right? When they talk
Yeah,
about
yeah,
biofilm. So
exactly.
that
So
sounds like
why is it such an important addition to your integrative treatment of a person with chronic Lyme?
yeah. And so many of you guys listening may have heard biofilms and don't understand exactly what it means. So with biofilm, it's these basic like colonies. It could be a mix of many different things, like including even parasites, fungi, uh, uh, bacteria, things like that, where they're actually like kind of binding together and allowing basically like a spirochete like Lyme disease or even viruses like walking pneumonia to be able to hide from its host. And so why that's a concern is that's why you'll see people that have gone through like years of treatment, including with antibiotics or herbs and things like that. And or usually antibiotics, the antibiotics can cause it to become sometimes a little resistant if they're on it for a super long time. It can actually produce even more biofilm too. And so what happens is they'll get off of treatment and they're like, oh my gosh, I feel like horrible again. And a lot of times it could be because the biofilm has not been addressed. And so you want to make sure if you're on any like treatment protocol in general, that you're on something to break up what's called this biofilm. And so what that does is they're typically fibrinolytic. So things that are breaking up fibrin, like nattokinase, lumbokinase. Even they've studied oregano, which is a great match if somebody's also been, has yeast. Stevia has also been tons of studies on that and also shown to be as effective as triple form antibiotics and good for persister infections. So basically what it's going to do is break up that biofilm so the spirochete can't hide. The challenge is sometimes people cannot feel so great when your biofilm's broken up because you're getting these things broken up, but it allows like that spirochete that's hiding to be unveiled in some way so that you can like fully recover and fully treat. So you definitely want to make sure whatever treatment you're on, if it's integrative, if it's allopathic or conventional, that biofilm is also addressed. Or you might see that like you get better and then you're not so great. And it's because the biofilm part is still there. So that those spirochetes were still in hiding, basically.
And I like that you use a natural approach in addition, of course, to antibiotics, etc. So, I remember you mentioned not only oregano oil, but cinnamon bark, garlic.
Yeah, cinnamon. Yeah, exactly.
Yeah,
Those are
yeah.
essential oils, and those have all been garlic. I love garlic. If we can get patients to take it, it has an active ingredient called allicin. A lot of people don't want to smell like garlic, but garlic kills a lot of things. Like it's great for bacterial infections too, but garlic has been studied, oregano, like you mentioned, and cinnamon, those as essential as actually oils too for biofilm and also just to be effective for tick-borne diseases as well.
I like that you combine herbal treatments. I mean, I'm being from Europe, obviously, in Europe, we used to, in older days, of course, use almost 60% of prescriptive medications were actually botanically based, believe it or not.
Wow, really?
Yeah. So,
and I know probiotics and things were being done in Europe like decades before it was being done here.
Yeah, and as well as fish oil. Mm-hmm. So it was actually giving, by spoon in the kindergarten, like we're talking about 60
that's
plus.
right. In Caribbeans, a lot of my patients from Caribbean, I try to get them back on fish oil. And they're like, because they have a vision of the disgusting cod liver oil that their mom gave them starting into school from 30 years ago or 40 years ago.
And we are catching up on all of that, yeah.
Exactly.
And I also know that you're pretty big on gut health, right?
Mm-hmm.
So, and of course, unfortunate, vicious cycle, with patients with Lyme disease that have to go through sometimes really lengthy antibacterial treatments, right? So, which disrupts gut natural microflora. So, how do you help those people to restore their gut?
That's a good point because some of the also antibiotics, or many, are also yeast forming. So I always mention that to patients. You definitely want to make sure you're on some things to support like probiotics, which you usually want to take about 4 hours away from an antibiotic. Things like oregano are great because they're also antifungal. Saccharomyces boulardii helps with fungal. So that's a probiotic too. So a lot of times I'll have people on things like lactobacillus and things like Saccharomyces that are combinations while they're on an antibiotic to make sure that their gut microbiome is still good and they're also not getting things like candida and yeast. So those are great. But there are studies that the gut microbiome, particularly Lactobacillus plantarum, has been shown to be helpful if it's more can be helpful for actually with treatment, integrative treatment with Lyme disease, particularly that form. So Lactobacillus is definitely one. And also there's different subspecies like Rhamnus and Reuteri that have also been connected with like mental health, and also autoimmune conditions. So I'm usually always making sure like Lactobacillus is in the mix because that is protective for other growth of other infections, and also things that are going to help like Saccharomyces as well.
Oh, that's wonderful. Yeah. And Reuteri, of course, also was known to improve the amount of oxytocin, right?
Oh yeah, I can't remember. I might be getting wrong. Is it
Dr. David
Rhamnus or
Davis?
Reuteri?
Yes.
One of them also increases up GABA. I don't remember which one, but it's either Rhamnus or Reuteri. So there's some that are connected. There have been studies. People know like a lot of your neurotransmitters are related to the gut, but even like specific microbiome, like Lactobacillus strain have been connected with like GABA and things like that, which actually are ones that help with things like anxiety.
Yeah. Oh, that's great. I also know that you are a success coach. I'm kind of curious. Well, when do you even get the time to
I
do
know
that?
that's my challenge.
Yeah. So, what does it exactly imply? I mean,
Yeah.
how do you help
So
people?
I started doing that. It's funny. I think during 2020, I got certified in a million things. I think I was bored. I got certified to be a meditation instructor. I got certified in like restorative yoga. I did the integrative psychiatry program, and then I also completed the certification for success coach. So the reason I did that was actually more like life coach, but it was actually more so for providers, for doctors. So it was for people going into the space of integrative medicine, because as a naturopathic doctor, there's still a small group of us, and a lot of people are getting there's more traction and more interest in integrative medicine. But a lot of people are like, what do I do? How do I start? Because as doctors or as practitioners, or we don't get taught how to run a business, how to run operations, how to hire, those kind of things. So I have experience just or having protocols. Like we learn so much, you get so much great education. You're like, okay, well, how do we put all of this together in a treatment plan? So I do help, and I have done like boot camps and things like that for docs on just like understanding how to put that whole piece together. And I also worked before, it's like I have many lives as like a healthcare person, healthcare world of healthcare executive too. So I actually like, I guess, problem solving on that side too.
Wow, that's an interesting different hat, because
Yeah.
I know you have an MBA degree, and but naturopathic, medical field is one of many other hats. So
and it's been great because I've even helped in some places in behavioral health, and I've helped create like integrative care within primary care, like in those larger settings, like behavioral health settings and health centers and things like that. So I've loved the ability to like introduce that into models that traditionally also don't have it. So that's how I started getting involved in that success coaching thing and certifying. But I then became too busy to do it. So I'm kind of in a little bit of a a break on that. So
well, that's really remarkable, I have to say. So, and how do people continue to connect with you? Because I know that a big portion, almost like 40% of your practice can be done just online, and you can help people from out of state, right? So to guide them through this treatment.
Yeah. So on my website, it's Fairfield, FAIR Field familyhealth.com. Again, fairfieldfamilyhealth.com. And also, I was going to suggest for folks to check out my website, women, even if you're a man, womeninlyme.com. And the reason is, if you go into the section, like on that first page of the website, I actually have a link where it'll email you all of the biomarkers, like what blood work to get tested for. So it goes back to the question that you asked me before, like you're like, well, what's some of the blood work you would test for? So it kind of shows it by like, okay, this is the autoimmune panel. These are inflammatory markers. These are things for your gut. So as those questions come up, it's like a 3-page list. So that's actually helpful if you're first getting worked up or if you have questions, like where to start. And so that's on that website, womenandlyme.com. So you'll get access to that PDF. It's like 3 or 4 pages too.
That's great. Thank you so much. Yeah, that's a great resource, Wesley. So, yeah, and we will list, of course, your websites and the links in our episode description on the page. So, yeah, thank you so much. It was such a pleasure talking to you, Dr. Patterson.
You as well. I'm so glad because we met at a conference. So I had a lovely immediate connection with you. So I'm glad that we were able to talk more. So thank you so much for having me on your show.
Yeah, and thank you for helping so many people. Yeah,
thank you.
A really impressive background that you have. So, yeah, have a great day. Yeah,
You too.
Yeah, and thank you for joining us at Cures, Remedies, and Beyond, exploring science and the wisdom of health and healing. We hope to see you next time.
This podcast represents the personal views and opinions of the host and the guests and does not constitute medical advice. The statements contained in this podcast have not been evaluated by the FDA. Any products or treatments mentioned are not intended to diagnose, treat, or prevent any disease. Cures, Remedies, and Beyond podcast with Dr. Irina is bringing together the science of medicine and the art of healing for ultimate vitality and health.